Hello everyone. You're here because you're experiencing lower back pain. Now you're part of the 60 to 70% of people who will experience lower back pain in their lives. What we're going to demonstrate to you is how to relieve localized lower back pain. Pain that's caused by irritation, muscle tension, and inflammation. We'll show you an easy test and an easy exercise that'll help you relieve that pain. First, let's talk about the test. As you can notice here, we've added a strip of tape on Kareem's lower back. It's going to help us to see which side has a greater range of motion. Now, Kareem is going to put his feet shoulder length apart, and he's going to lean to the right and to the left. Now, another thing that can help us to notice which is the easier side or the greater range of motion is the tip of his fingers. So lean to the right, and as you can see, the tip of his fingers end at his knee on the right side. And we can notice that this line is also quite straight. Now lean to the left. So, as you notice here, his fingertips go below his left knee. And this curve here is also more pronounced. So, the side that has a greater range of motion is the left side. And we need to remember that point. But before we do any exercise in a clinical setting, we like to use a spray or a cream that lowers the pain. So in our clinic, we use Triumph Daily MD. You can use any spray you want. We use this one here because the magnesium helps with muscle spasm and the beta-aniline helps with physical exercise capacity. So what we'll do is we'll ask Kareem to spray some on his hand and rub it on his lower back, but you can spray it directly in the area that hurts. Excellent. He's going to start to feel the action pretty quickly. So now Kareem will lie down on his back. As you remember, on Kareem, the left side was the easy side. It was easier for him to lean to the left than to lean to the right. So he's going to use his left knee. He's going to raise it up, and he's going to put his right hand across from his knee. The exercise is a contraction to bring his knee across his body, but his hand is going to resist it. And it's a 5-second contraction and a 5-second rest. So we'll start. Contraction for 5 seconds, 4, 5, and now rest for 5 seconds. Again, he's going to do that 3 times. Contraction for 5 seconds and rest for 5 seconds. One last time. Again, the contraction is to bring the knee across his body and his hand is just resisting it. So he's done it 3 times. Now let's retest and see the difference. So now let's retest and see what we've accomplished. Kareem is going to lean onto the left side. And we can remember that his fingertips would go below his knee line. And this had a beautiful curve to the left. Now let's see if it improves on the right. He can go much further. Now, like the left side, his right fingertips go below the knee line, and this has also improved into a beautiful curve. So what did we accomplish by this exercise? Well, we've increased his range of motion, but that will help to reduce muscle tension, irritation, and inflammation. And when you do this exercise, you will relieve your local lower back